Life Planning. Introduction. Healthy people should not make end-of-life plans. Select true or false. Correct. Healthy people should consider making healthcare plans. Unexpected accidents or other illness could happen. It is always easy to tell when a person with a chronic disease is going to recover from a health crisis. Select true or false. Correct. Most of the time, there is no real way to tell if a person with a chronic disease who is having a health crisis will recover or not. A surrogate is a chosen person that can speak for you if you cannot speak for yourself. Select true or false. Correct. A surrogate is a person that is appointed to make decisions for you when you cannot speak for yourself. Having a plan can provide comfort to family and friends. Select true or false. Correct. Expressing your wishes for a time of crisis may provide comfort for your family and friends because they know that they have honored your wishes. Dialysis cleans wastes out of the blood when the kidneys cannot. Select true or false. Correct. Dialysis is a treatment that replaces or supplements kidney function. IV fluids and tube feeding must be given together. Select true or false. Correct. You can choose to have an IV and tube feedings. They do not need to be given together. A ventilator is a type of life support that helps you breathe if you can no longer breathe on your own. Select true or false. Correct. Ventilators are mechanical machines that breathe for people. It is up to your family and friends to decide what kind of treatments are right for you. Select true or false. Correct. What treatments you want or don't want are your decision. Make sure to communicate them clearly with family, friends, and your healthcare team. The choice is yours. Choosing the best person to speak for you in a crisis is the first step of planning. Select true or false. Correct. Thinking about your values and deciding what is right for you is the first step in the planning process. Which of the following allows you to name a person to make decisions about your care if you cannot speak for yourself? Choose one of the following options. 1. Post. 2. Durable power of attorney for healthcare. 3. Living will. Correct. A durable power of attorney for healthcare allows you to name a person to make decisions about your care if you cannot speak for yourself. People usually ask a family member or close friend. Palliative care is only for terminally ill patients. Select true or false. Correct. Palliative care can help a person of any age, whether or not the illness is terminal. Thank you for using Explain.